This morning, we're following an important health story for families. You want to pay very close attention to this. The CDC has unveiled plans to update its childhood vaccine schedule and cut down on the number of vaccines recommended for all children. The change comes despite pushback from the American Academy of Pediatrics. Your reporter Taylor Knight live in studio this morning, breaking it all down for us. Taylor.
Good morning, Kate. Under these new guidelines, the CDC will now recommend vaccines for all children for 11 diseases instead of 17 diseases. But other vaccines will be recommended only for high-risk groups such as the flu and rotavirus. The Department of Health and Human Services' upcoming guidance is expected to keep many recommendations the same. That includes for diseases like measles, polio, chickenpox, and HPV. But it is cutting recommendations for RSV, meningitis, and hepatitis, except in kids who are at a higher risk. We talked with the head of pediatric infectious diseases from Connecticut Children's, who says the guidance has always been based on good science.
But I go back to the science. I go back to the evidence. And we know that for all the vaccines in the current childhood vaccine schedule, they are safe and they're effective.
He says if parents do have any questions or concerns, they should consult directly with their child's doctors. In the next half hour, Dr. Michael O explains his concerns with this new guidance. Your reporter live in studio, Taylor Knight, Channel 3 Eyewitness News.
All right, Taylor, thank you.